नमस्कार। आज हामी स्केलेटल सिस्टमको मेन पार्ट बोन र बोनको फंक्शन बारे हामी चाहिँ डिस्कसन गर्छौं। फंक्शन अफ द बोनको धेरै कामहरू छ। त्यसमध्येमा मेकानिकल फंक्शन जुनमा चाहिँ protect internal organs and fragile body tissues. The brain, eyes, heart, lungs, and spinal cord are all protected by skeleton. Cranium or skull protect brain and eyes. The ribs protect heart and lungs. And vertebra or spine or backbone protect spinal cord. Support. The main job provides support for body. Skeleton is strong but light. Structure provide a frame to keep the body supported. Sound transduction. Bones are important in the mechanical aspect of overshadowed hearing. Movement function. Bones provide leverage system for skeletal muscles, tendons, ligaments, and joint function together to generate and transfer forces so that individual body parts or the whole body can be manipulated in three-dimensional space. The interaction between bone and muscle is studied in biomechanics. Synthetic function. Blood production. The marrow, located within the medullary cavity of long bones and interstices of cancellous bone, produces blood cells in a process called hematopoiesis. Metabolic function mineral storage. Bones act as reserves of minerals important for body, most notably calcium and phosphorus. Growth factor storage. Mineralized bone matrix stores important growth factors such as insulin-like growth factors, transforming growth factor, bone morphogenetic protein, and others. Fat storage. The yellow bone marrow acts as a storage reserve of fatty acids. Acid-base balance. Bone buffers the blood against excessive pH changes by absorbing or releasing alkaline salts. Endocrine function. Bone controls phosphate metabolism by releasing fibroblast growth factor 23, which acts on kidneys to reduce phosphate reabsorption. Bone cells also release a hormone called osteocalcin, which contributes to the regulation of blood sugar and fat deposition. Osteocalcin increases both the insulin secretion and sensitivity, in addition to boosting the number of insulin-producing cells and reducing stores of fat. Detoxification. Bone tissues can also store heavy metals and other foreign elements, removing them from blood and reducing their effects on other tissues. This can later be gradually released for excretion. यसरी बोनको विभिन्न फंक्शनहरूलाई यहाँ सर्टमा टेबल फर्ममा पनि दिएको छ, हेर्नुहोला। अब हामीले एक्स्ट्रा कुराहरू जान्दाखेरि बेटर होला। Who has more bones, a baby or an adult? Babies have more than adults' bone. At birth, have about 300 bones. As grow older, small bones join together to make big bones. Adults end up with about 206 bones only. Bone alive हुन्छ कि हुँदैन होला त? Absolutely. Old bones are dead, dry and brittle, but in the body, bones are very much alive. They have their own nerves and blood vessels, and they do various jobs such as storing body minerals like calcium. Bones are made up of a mix of hard stuff that gives them strength and tones of living cells, which help them grow and repair themselves. Bone केले बनेको होला त भन्दाखेरि a typical bone has an outer layer of hard of compact bone which is very strong, dense and tough. Inside this is a layer of spongy bone which is like honeycomb, lighter and slightly flexible. In the middle of some bones is jelly-like bone marrow where new cells are constantly being produced for the blood. Calcium is an important mineral that bone cells need to stay strong, so keep drinking that low-fat milk. Broken bone heal कसरी होला त? Bones are tough and usually don't break even when we have some pretty bad falls. I'm sure you have broken a big stick at one time when you first try to break the stick, it bends a bit, but with enough force, the stick finally snaps. It is the same with your bones. Bones will bend a little, but if you fall the strong way from some playground equipment or maybe your bike or skateboard, you can break a bone. Doctors call a broken bone a fracture. There are many different types of fractures. Luckily, bones are made of living cells. When a bone is broken, your bone will produce lots of new cells to rebuild the bone. These cells cover both in of the broken part of the bone and close up the break. अब फ्र्याक्चर कसरी हिल होला त भन्दाखेरि bones need regular exercise to stay as strong as possible. Walking, jogging, running and other physical activities are important in keeping your bones strong and healthy. Riding your bike, basketball, soccer, gymnastics, baseball, dancing, skateboarding and other activities are all good for your bones. Make sure you wear or use the proper equipment like a helmet, kneecap, signboard, mats, kneecap, etc. to keep those bones safe. Strengthen your skeleton by drinking milk and eating other dairy products like low-fat cheese, frozen yogurt, and ice cream. They all contain calcium, which helps bones harden and become strong. Thank you.